Hello, everyone. Thank you very much for joining us today for this Call for SMEs webinar for the Croatian region, so from the Primorsko-Goranska region, one of the funding ecosystem from the HealthChain project. So we are now waiting for people to join. I want to start saying that my name is Maria Bernabé. I work at Environment as project manager, and I would like to give you some housekeeping rules for this webinar. So this session will be recorded and you will be able to catch a webinar replay in our website in 1-2 days after this session. And all participants are now muted, and you can send us your question and type them in the Q&A box that you can find in the navigation bar, the bottom of the screen. So please feel free to send us your question, and then we will be addressing them at the end of the session after the presentation. So this is the agenda of today's webinar. So I will present the project, the HealthChain project in a nutshell, so you can get the main detail of this project. Then an overview of the open call for SMEs and the next steps. So this is the first part, and then we will dive into the challenges and the leading SMEs proposing the solution from the Primorsko-Goranska region in Croatia. So the project in a nutshell, so what is HealthChain? So we are based on an ecosystem, an ecosystem approach. So this means that all the stakeholders involved are taking a stake in the process. So then they are working on a demand-driven, so from the healthcare organization needs. So they are identifying challenges and then challenging the the supplier side to co-create and pilot innovative solutions to address and cover these innovation needs that the healthcare organization have identified. And we are also committed to adopt this innovative solution if they are successful. So at HealthChain, we are trying to implement a new innovation model to increase the capacity of the healthcare organization to innovate, and this will result in digital solution with a higher success rate, and also increase and speed up the internalization process of the company. So this means that they will have the opportunity to scale up and commercialize the solution after the project if they are successful. In terms of the interregional component that we have to cover in HealthChain, we have 10 regional ecosystems so far. So we started at the very beginning with 5 founding regions. So, and now we have onboarded new additional 5 middle regions. So we have now this new region that are replicating our HealthChain model, so our innovative model that we are implementing. So they are replicating to increase the capacity of their regional innovation ecosystem. When it comes to this open call, so we have recently announced the HealthChain open call for SMEs to select and support 10 follower SMEs, so 10 solvers that complement the expertise of 10 leading SMEs and jointly co-create a solution, a digital solution that address the specific innovations, so the challenges that the healthcare organization have already identified. So the benefits for these awarded SMEs are the following, as you can see in the slide. So they will be jointly co-creating and piloting the digital solution with the leading SMEs for the challenge identified by the healthcare organization. They will also access funding up to 50,000 euros, equity free. So it's a grant. So they will get the 100% of the amount. And they will also get expert support on business modeling and market insights. So, and they will have the opportunity to access to a very big network and resources of this consortium. So they will network with other European SMEs and organizations in this consortium, and they will have the chance to explore new opportunities for new endeavors beyond the projects. And last but not least, they will get the opportunity to work in an international partnerships, since the leading SMEs are legally established in the HealthChain regions, but we are looking for SMEs from other consortium regions, so as follower SMEs. So this is an overview of the call. So what you have to keep in mind is that the deadline to apply is it's August 5th this year, so at 5 o'clock Central European time. And you will get, as mentioned before, 50,000 euros per SME. And we are looking for 10 SMEs, so one per challenge. So the 5 healthcare organizations in the region have identified 10 challenges, so 2 challenges per region. And this is why we are looking for 10 SMEs, so one per challenge. For the Croatian, the Primorsko and region challenges, we are looking for 2 SMEs, so one per challenge. When it comes to eligibility to apply, so who can apply to this call? So in terms of the typology of the organization, so we are looking for a small and medium-sized enterprise. So they are the only organization that can apply, that are eligible to apply to this call. So research centers, foundation, and other kind of organizations are not eligible to apply. So only SMEs, only a small and medium-sized enterprise when it comes to the typology of the organization. So when it comes to the geographical criteria, so we are looking for SMEs based in the regions that are part of the HealthChain project. So this means that we have 5 regions, 5 founding regions, and other 5 middle regions. So the limitation of this call is that the follower SME must be legally established in one of these regions, but if it is established in a founding HealthChain ecosystem region, so this follower SME must be different to the region where the challenger is based, so different to the healthcare organization region. So the region are the ones that you are seeing in the slide, but you have to read carefully the guidance for applicants and to be sure that you are eligible to apply. So these are the eligible regions in this call. So then we have the middle regions, as I mentioned at the very beginning of the presentation. So we have these new 5 middle regions that have recently joined the consortium, that are Western Greece, Navarra in Spain, Castilla y León in Spain, Flanders in Belgium, and Northwest Romania. So we have the founding regions and the middle regions. So you have to keep in mind and to have a look if your follower, if your SME is located in one of the regions, and then if you are applying to a specific channel, to ensure that you are not applying to a challenge that proposed, identified by the healthcare organization established in your same region. When it comes to the application, so please read the guidelines for applicant. It's very important you get all the information in order to apply and to know if you are eligible or not. And so you can find this document in our website. So it contains and describe the rules and the processes of this open call. So please download this guideline and ensure that you can apply. So then you have to fill in the proposal template. So this is a document that you can edit. So it's a Word document. So you have to fill in the document and then to convert it in PDF in order to be submitted via the FCSS platform. So first you have to fulfill the documents with the information and completing all fields you are required to, and then submit the proposal via the FCSS platform. So you have to complete the required files and upload the proposal in PDF. In terms of the obligation that you have as a follower SME, and you will have to submit deliverables together with the leading SME. So you will have, during the 12 months for creation, you will have to submit these 3 deliverables. So the first deliverable, it's related to the co-creation agreement and pilot action plan. You have to report in this document the main objective, activities, timeline, and resources for the testing of the innovative solution before its implementation. So before it starts the co-creation and pilot phase. And then in April 2025, you will have to report the implementation of the activities through this interim report on co-creation and pilot deployment. So this is the deliverable 1.2 that will be submitted in March 2025. And finally, you will have to submit the final report on co-creation and pilot deployment in September 2025. So in this document, you will report the overview of the implementation activities. So the whole process, the whole 12 months co-creation phase and process. In terms of the financial support, you will receive the grant amounts when you submit the second deliverable. So the first deliverable, the pilot action plan, it's not linked to payment. So you will receive the first part of the budget in May 2025. So just 1 month after the submission of the deliverable 1.2. So if this deliverable is accepted, you will receive, we will transfer you the first part of the grant amount. And then at the end of the phase of the co-creation and pilot phase, you will receive the second part of the budget. So it is expected in November 2025. So if your deliverable 1.3 is accepted, you will get this second part of the budget. So this 25,000 euros. And what happens if you have any questions? So we have opened this FCSS blog in the FCSS platform. We have a page dedicated to the question and answer. So you can send us all the questions you may have, and we will take them and answer them as soon as possible. So you can access the platform and go to this page. So please feel free to type the question, and I will come back to you as soon as possible. Okay, so as I try to be very, very brief, because we already have the informative webinar last week. So we arranged this webinar to launch the call, and now we have the webinar replay uploaded on our website. So feel free to access and to watch, to catch up on the webinar replay. So it's available for you, so you can go into more details watching this webinar. Okay, and now before giving the floor to the healthcare organization and to the Croatian hospital and the leading SMEs, I just want to remind you the next step. So please read carefully the Call for SMEs document that you will find in the HealthChain website. Then ask the question you may have through the FCSS blog, as I just mentioned, and then ensure that you fill in the proposal and submit it before the deadline, before the 5th of August, via the FCSS platform. So now I'm going to stop sharing my screen to give the floor to Theodora, the representative from the Croatian hospital. So Theodora, it's over to you. You can start.
Thank you.
And then we will move to the leading SMEs, the solution proposed by the leading SMEs. Yeah, Theodora, okay. Over to you. So, Yelena, are you going to share the presentation? Okay, right.
Okay.
Thank you. So you can start.
Okay. Hello, everybody. Thank you very much for being here, and hello to our associates. Well, I'm Teodora Zaninovic-Jurjevic. I'm a cardiologist, non-invasive one, working in Clinical Hospital Center Rijeka. Also, many years, well, about 10 years, I'm also working in some dislocated cardiology infirmaries around our clinical hospital center. So I would like to tell you some words about our challenges. Može dalje možda ili ja to radim?
Jelena needs to...
Jelena needs to go further with my little slides. Jelena, please, could you do that for me? For the presentation, to go further?
I'm sharing, but nothing's happening. I went to next slide, but can't you see it?
No, I just see now it's fine. Now it's fine. Thank you.
Okay.
So no, it is we went already on the 7th slide. I would like to have some slides before, a little bit to say about our clinical hospital, one before that, and the 4th one would be nice. The 4th one, Jelena, please. Okay, this one. So we are positioned in our county, that is Primorsko-Goranska County, and this is the biggest clinical hospital center. And as you see, these are some regions very near the sea, and some regions are in the mountains. So geographically, it is very different, two different parts in our county. And we are one of 5 clinical centers in Croatia with this very specific geographic region. And we have 3,456 employees and 1,069 hospital beds. And we are regional hospital center covering 3 counties, not only ours, which is Primorsko-Goranska County, but also the Istria County and Lika County is also coming to our hospital. And we provide medical care for approximately 600,000 inhabitants. And more than 45,000 patients are hospitalized per year. Around 3,000 outpatient services are provided, and 600,000 outpatient visits. In the day hospital, around 190,000 hospital services are rendered. Please, can we proceed? So we have challenges. As I already mentioned, we do our dislocated infirmaries with our specialists around this clinical hospital center that is in Goranska County. And so we need some better solutions to better provide healthcare for our patients. And please, the second one. So first, I want to say that these are remote areas, as I already mentioned, in mountains and islands of the Northern Adriatic Sea. The center aims to improve access to healthcare in these areas through dislocated infirmaries and telemedicine. And as we know, cardiovascular diseases are one of the main problems or main diseases in the Western world, and a lot of morbidity and mortality. And usually one of the group of these patients are those with heart failure. And this is also one of the important medical issues in Croatia or in part of cardiovascular medicine. So those patients, when they are released from the hospital, they come to Clinical Hospital Center at least once or 2 times per year. And when it is urgent, they come earlier. So if we have some MediLink challenge or to follow them in a digital way, then this following should be continuously and not this few spots when they come very continuously. And we can approach to them with evidence-based medicine and upgrade it more faster and more and better for them. So please, the next slide. So if also we know that GPs are interested in telemedicine for maintaining their patients, but minority have practical experience about that. But if we proceed with this MediLink and digital wave and telemedicine, then maybe that will encourage GPs to have a more experience, to have better following, to have better care for their patient. So the solution shall be a platform, portal, or application. It must provide secure communication for real-time video conferencing, secure messaging, collaborative discussions between specialists that are we, cardiologists, patient, and family doctors. And it should be intuitive and user-friendly. The system should work as an individual solution. The solution shall be scalable to accommodate potential increases in user numbers. Different video calls can be done at the same time. So please further. And the language mode should have a possibility to choose the Croatian language. Digital way of patient physical examination, that is very interesting. Family doctor can use the digital stethoscope to record the heart or lungs of the patient and send it to the specialist that are in the Clinical Hospital Center. And we are not physically present, but we can help by analyzing physical status. An interface for collaboration between 2 or more remote locations, exchange of medical documentation, and then input of digital for digital transmission of health and vital signs of the patient on the other location, remote stethoscope, remote thermometer, etc. So we have SMEs who will further tell us about the solution. Thank you.
Marisa, sorry, you are muted.
Can you hear me now?
No, okay, perfect.
So I'm Marian Gregoric. I'm the owner of the company Bit for Bytes, and we are the leading SME for the problem of telehealth platform. So the key features of the platform will be the real-time video conferencing and secure messaging. So seamless communication between specialists, patients, and family doctors, enabling simultaneous consultations and collaborative care. There will be another key feature of this platform will be intuitive interface, which is like user-friendly design, which ensure ease of use of healthcare application for the healthcare professionals. The application will be scalable, so growing, which we are predicting that the user base will be growing. So we are going to have multiple concurrent video calls, ensuring flexibility and adaptability to evolving healthcare needs. There will be collaboration interface which facilitates the exchange of medical documentation between remote location and enhancing the collaborative efforts. So this is like in short term what the platform will do. I forgot to mention that the company is more like 6 years on the market. We are a specialized company for the platform, so we are actually still not decide what the finished product will look like. So development process will be on the analysis, investment, document pilot project requirements, design, which is covered by we are designing the prototype based on specific requirements and objectives. Development, after that development and adjusting the platform according to the design phase. Then after that we're going to have delivery phase, which be the deployment to solution of the solution with the real environment. And also we are going to give some support competition for user training session, which ensures healthcare staff are proficient in using the solution. So this is like some kind of development. This is going to be a development process. What we need is like for the testing. See this slide. We need from the follower SME for the testing. So functional testing, usability testing, performance testing, and security testing. Also, we are expecting from the follower to be involved into user testing also to check and validate maybe in prototypes in the early phase. Functional testing ensure the platform performs intended functions accurately. Usability testing evaluate the user interface and experience for the healthcare professionals. Performance testing is access performance under the various conditions to ensure reliability. Security testing is identify and migrate vulnerabilities to protect against cyber attacks. So this is in short terms what the platform will be doing. And that's it. We can talk and you can ask me later for more information if you have. Can we move next slide?
Yeah, thank you, Marjan. So let's move to the second challenge. Theodora, it's over to you.
Okay.
Hello again. Thank you, Marian. So the second challenge for our clinical hospital center is real-time patient monitoring during independent movements in the hospital. This we call as acronym FallPredict. That will be followed and realized in the clinic for cardiovascular diseases, especially in department for heart failure, for cardiomyopathies and valvular heart diseases. Dominantly, there are hospitalized patients that are usually older and not so secure while walking at the hospital halls, going to the toilet, having their care of themselves by themselves and being independent of some help or other health providers there. So they will be more mobile and they will feel comfortable and more secure for themselves. We think that wearable sensor will track changes in posture and movement, specifically focusing on detecting loss of balance and fall during the hospital stay. Artificial intelligence model built for recognition of fall detection incidents. And the nurses, caregivers receive real-time alert and notification from the fall detection system so they can quickly react. That is our challenge, and that allows patients to have more mobility and independence within the hospital, and the use of wearable sensors for fall detection will be optional. Please further. So the solution shall support and include patient health devices, for example, wearable sensors on the patient or their clothing, wrist, leg, slippers, to accurately detect changes in posture and movement. And then to ensure optimal usability, effectiveness, and user comfort, and immediate alerting, that is also very important, when a potential fall is detected in real time, and it must show the exact location of the patient at the time of alert, user-friendly interface for healthcare providers to view real-time data, alerts, and patient information related to fall detection, and the system should be able to monitor several patients at the same time. Please further. So the following requirements must be achieved that are compact design and lightweight, comfort and skin-friendly materials, water resistance. Sensors should be able to work normally without recharging or charging batteries for 30 days. And then there should be wireless connectivity, and language mode is to be chosen the Croatian language. That will be the best. Please further. So I would like Representative Živko from Sparky to tell us something more about the Stability Guard. Thank you.
Thank you very much. My name is Živko. I'm from Sparky. We are responsible for Stability Guard development, or pretty much the fall detection system as described previously. So you can go to the next slide so we can present the description. So the three main points are wearable sensors, AI model, and real-time alerts and notifications. Regarding wearable sensors, probably it will be a smartwatch. We'll still see with a hospital, but what we need are as much data as possible to collect about the position, mainly about various factors that can detect us the location of the patient and the fall. The AI model will use that data, that sensor data, and predict the fall detection, which will be used by the real-time alert and notification system to notify medical staff about the fall. And the ability should be to track multiple patients at the same time, to have a dashboard where you can monitor all of the needed metrics, and also to provide the needed alerts and notification in case of the emergency. In next slide, regarding our part, regarding requirements that we cover, is mostly regarding project coordination and risk management. So pretty much to guide you during the entire project process, together with the medical staff from Rijeka. Regarding technical development, what we plan to do is design, develop, and integrate entire hardware and software described here as a final solution. This technical development, once it's done, we will perform also initial testing and evaluation. But of course, this is the main task that is needed also by the full SME to help us in the testing and evaluation, especially for the security, which we'll see on the next slide. Regarding workshop and training, also to help us together to do the workshops and the training needed to not just for the medical staff, but also for the patients, for the all stakeholders included in the project. Regarding your responsibilities, which are on the next slide. Thank you. It's mostly regarding quality assurance, so various tests that will be concluded. So we and you, your organization, will sit together and conclude which will be the best test case scenario that will be included in a project, what we can use to guarantee the quality at the end of the project. Data security and integration is especially important since we are dealing with real-time data, with patients' information. So there are also a lot of sensitive data, and we need to eliminate any data leakage, any potential breaches. We need to anonymize data, and you will be a support in this specific case. And finally, regarding workshops, regarding trainings, as we described previously, this is some activity that will be executed together with us, with staff from the Rijeka, and hopefully to describe all of the needed elements from the system. So pretty much this is it regarding all of the important steps. If you have any questions, you can ask us now, or if you need any additional information, they are on the website. Thank you.
Excellent, Živko. So thank you very much, Teodora, Marian, and Živko for this overview of the challenges, solution, and the profile of the SMEs, the follower SMEs you are looking for. So the next step are the ones that I mentioned before, but yeah, so just for you to know again. So you can find everything regarding the call in the website. And yeah, so keep in mind that the deadline to submit the proposal is on the 5th of August. Now we have time enough for the Q&A. So we have received a question through the chat from Mirjana. So the question is, are SMEs eligible to be followers for challenges from Croatia? I suppose that Mirjana is asking if the Croatian SMEs are allowed to apply for the Croatian challenges, so from the challenges identified from Rijeka Hospital. And yeah, the question is, so in Croatia, the SMEs that are eligible to apply and to apply for these two challenges already presented are all the regions except the Primorsko-Goranska regions, because in the Primorsko-Goranska region, it's based the healthcare organization. So this is the only regions that are not eligible to apply. So the follower SMEs can be from all Croatian regions, so from the whole country except the Primorsko-Goranska region. So I hope I have answered the question. If not, please let me know. So in this, for these two challenges and these two solutions proposed by the leading SMEs, we have, yeah, so we can receive a proposal from all the country except the Primorsko-Goranska region, where the Rijeka Hospital is legally established. So if you have any other question, we have not received any more questions, so everything must be pretty clear. Anyhow, you will have the opportunity to catch up our webinar replay in our website after the session. So tomorrow, hopefully, will be already available. So I don't know if you have you want to add anything else, Theodora, Marian, or Sivko. You want to highlight or to point out any details that you want to share with the attendees and with the potential applicants to encourage them to apply. And anyhow, you have also the FCSS blog, so you can reach out us there and you can contact us and send us the question that you may have regarding the call for the application, the details from the call, or the challenges and solution proposed by the leading SMEs, by Bit4Bytes and Sparky Solution. So we are here to help you and to answer you and to solve you all the doubts you may have. So if we don't have any more questions, I think that we can close the session here. So thank you very much, all the panelists, all the presenters, so Sivko, Theodora, Marian, and Elena too, for presenting the challenges and the solutions. So we are looking forward to receiving your proposals. So have in mind that the deadline is on the 5th of August. So you have now time enough to prepare a very good proposal to complement the solution already proposed by the leading SMEs, and finally to address and cover the needs, the problems that the Rijeka Hospital have now. So this is the main objective of to improve the healthcare system in Rijeka Hospital and to cover the patients and healthcare professional needs. So thank you very much, everybody, and hope to see you soon applying to these two challenges from the Primorsko-Goranska region. Thank you very much. Bye.
Thank you.
Thank you very much.
Bye.
Thank you.
Bye.
Thank you for
Thank you.
listening.
Bye. Bye.
Bye-bye.